All right. Welcome again, once everybody, to the Wednesday night webinar. I am Dr. Patrick McGrath. Great to be here. And this is brought to you by NoCD. NoCD, a downloadable app you get through Google Play or iOS. Please check us out there. And if you're looking for a teletherapy for OCD or hoarding or BFRBs like excoriation or trichotillomania or tics, we have that covered, and we take most insurances here in the US. So reach out to us at nocd.com or download that app and then hit that therapist button on there, and we'll be able to get you taken care of and set up. We've got people waiting by right now. And in celebration of March being our No OCD campaign month that we kicked off with Howie Mandel, thank you, Howie. We are offering right now for people who don't have insurance and are having to pay with cash. We know that it can be expensive to do therapy. And so we've got a reduced rate of $100 per session for new members, as long as you do your sessions within the next 48 plus 5 hours. So as long as you get them in by midnight on Friday night. And that $100 rate will last also for 2 months for all of your sessions as well, too. So check us out, everybody. Go to nocd.com, and we'll see what we can do to get you set up. Jess, welcome back. Good to see you again. How's it going?
Hi. It's going pretty good. Good to be here. Excited to be here. Thanks.
Awesome. You wanted to come back because you had a couple of things you wanted to discuss tonight, I know. So we'll get to some of those things while we're going through our questions as well, too. But what was one of the things that you wanted to make sure that we addressed tonight?
Well, I wanted to talk a little bit about insight with OCD. And so I'm working in peer support, and I was having a discussion with a clinician, and insight came up, and it really disturbed me to recognize that during much of my OCD, I either had absence of insight or very, very poor insight. And so I did, reach out to you and ask you a question about that, and I went on this whole journey of about insight. But so I did want to talk about it and kind of bring awareness to it, because I think that we can improve our insight, and by improving our insight, we can improve our OCD symptoms, and it will decrease our negative symptoms.
So what was it like for you when you had that low or no level of insight into your OCD? How was that different than how you feel about things today?
It was kind of almost like being in a different world. It was definitely being inside my mind, like kind of captured inside my own mind, doing compulsions and having high anxiety, that intense doubt, staring at a doorknob, seeing physically, like seeing that it's locked, but knowing that in my brain, it's like, it's not locked, or are you sure it's locked? And so that was like, the belief that it was not locked, even though I could see it locked, was lack of insight. Because I believed that it was not locked, even though I could see it was locked.
So basically what you're saying is that there was nothing that could prove to you something that was so frightening and overwhelming as a way to undo the belief in that thing, that belief was your truth and not the actual experience or event at the time.
Correct.
Yeah.
The belief, yeah.
And I think a lot of people have probably gone through levels of insight in their OCD as they've experienced it, where they've doubted it more times and they've believed it more times. And so not only is there maybe a switch in the theme of OCD, but there might be also some switches in intensity of OCD as well, too, right?
Yes, I've definitely experienced that as well. Yeah.
Cool. Well, I'll be interested to see what other people have to say about that as we go through this evening, and as we look at some of our questions tonight, and we could talk about it from some insight level as well too. So let's jump into some of the Q&A here. We've got Captain Cass, a longtime listener. Hello, Cap. Dr. McGrath says, so you might be offered this month-long study abroad thing, which you're really excited for because it aligns perfectly with your interests, but you also know that you'll likely see it as the hardest exposure for your OCD that you've ever done, as is the curse of studying emergency infectious diseases. Yes, I suppose that could that could be tough when you have OCD. And it will be long-term 2-day trip by riverboat kind of forest remote thing. Part of you wants to say screw OCD, since this is, oh, you know what, Jess, I'm hearing some feedback from you right now. Is that better? Nope, I'm still getting some feedback. So I'm gonna, if you want to mute yourself for a minute. I can mute you, actually. There we go. I got you muted. Part of you wants to say screw OCD since this is something you love, but like this is a big exposure and you don't want to psychologically lose it and have to go home or something. Any advice or tips on going or not going, especially on dealing with OCD without a therapist in an extreme scenario? Well, I would start right now, if you have a therapist that you are working with, making sure that this becomes the focus of the work that you're going to be doing, right? You make sure that this is exactly what you are working on and focusing on. And you approach going to your labs that you work in or your job where you might be coming in contact with some of these types of things as well. And you might even want to spread out or space out some of your therapy sessions as well too, so that you have to kind of go longer in between sessions. You don't want to do potentially more sessions, which some people might say would be the thing to do right now at the moment. Get as many sessions in as possible, but and that could depend on when this is going to be. I mean, if it's going to be in the next month or so, maybe that's helpful. But if it's going to be a while from now, you might want to say, you know what, we're gonna put time between so that you can really build up to having less and less time with the therapist while you're having to deal with a stressor. And one of your stressors might just be going on this thing. So I would take a look at when this is going to happen. How can you space out some time between your therapists so that you can practice this on your own, and you can very much expose yourself to things that will be similar to what you might find on the trip as well too. So I just want to test. Nope, still getting that feedback, Jessica. So I'm going to keep you on mute until you get that fixed there. All right. Oh, Delise says, want to say hi to Jess. Hope you're doing well. It's David, so you get a shout out. Daisy says, can you please give an overview of the diagnosis process of OCD? Can you be diagnosed with OCD if it causes distress but does not really interfere with your life, your day? Thank you. So we diagnose OCD based on two things: the experience of obsessions and the experience of compulsions. Obsessions are intrusive thoughts or images or urges that people have that they find to be intrusive or inappropriate. They can cause distress, discomfort, those types of things. And they would do something to neutralize that. And that's where the compulsion comes in. The compulsion is a behavior or mental act that someone does to try to neutralize the obsession. Now, to have a full diagnosis of OCD, you would want it to be interfering in somebody's life. And the DSM actually listed out as an hour a day or significantly interfering in somebody's life. If you're not having that, Daisy, I don't know that I would diagnose you with OCD, but I could diagnose you with like an anxiety disorder, an OCD related disorder, not otherwise specified, meaning you're not fitting the true full criteria for OCD. But if it is still causing a problem in your life and leading to issues, it's still a diagnosable condition that can still be treated. It's just not fully meeting the criteria of obsessive compulsive disorder. So that might be one way to do it. And the beauty is you can do ERP for both of them, because if you are still in distress, there is a chance to still get treatment for that to help you decrease the distress that you might be in. So you could still definitely go ahead and work on getting that diagnosis and see what happens. Christian says, can you give your thoughts on psilocybin treatment for OCD? I haven't seen a lot of research on it yet, exactly how the outcomes are looking, so I can't really comment on it. But I think at some point in the future, we're going to get Dr. Jamie Fiesner on here, who's our chief medical officer. And so those would be some questions we can ask him. And also the idea here that you ask Cartoon King 3, is there vitamins you can take to help manage OCD? We'll have him answer that as well, too. So, all right. Jessica, hey, no feedback, it sounds like.
Is it better?
It's a little bit better, yeah. So.
Okay. I did a few things.
All right, good.
Okay.
Anything you wanted to add into what we were talking about there?
Well, the person, well, hey, David, hope you're doing well. But so the Captain Cast that's going on a trip. So trips have been very hard for me, and but I encourage you to not allow OCD to be the deciding factor on not going. Um, I think it's very important for us to continue to live towards our values, and by deciding that not going on the trip, you're telling your OCD something. So, whatever you need to do ahead of time to prepare yourself, and then just bite the bullet and go, because I can assure you that you're probably not going to feel like, oh, I'm 100% ready. I'm going to go on this trip. I'm not going to have any OCD. It's going to be great. Like, expect that is not going to happen, and go anyway. So that would be my advice in that.
Absolutely.
That's what I would do with my OCD in that situation. Um, yeah, I just, yeah, that's what I got.
All right. Delius 1997. Glad you're back. Good to see you again. Emery says, do you have any advice for dealing with OCD about taking medications? Yeah, so I'm going to mute you again, Jess. So yes, definitely have some things about OCD and taking medications. OCD will tell you that things that are helpful to you are potentially bad for you, right? You're gonna have that happen all of the time. So ERP, don't do it. Medications, don't take them, right? OCD does not want to go away. So OCD is going to definitely interfere in your doing anything that could potentially be helpful to obsessive compulsive disorder, right? Because helpful in terms of making it go away, I should say. So OCD is going to send you a bunch of lies that it's going to want you to buy into and believe in, to get you to not do anything to challenge OCD, because ultimately OCD doesn't want to go away. OCD wants to stay right where it is and wishes you would just stop doing all of these things to try to make OCD go away. Therefore, why would we have issues about taking medications? Well, OCD might say, well, you did read that entire little folded up piece of paper that when you unfolded it is bigger than a football field. And you read every single word on it. And you saw that there was one person at one point in one country, one time, who had this one reaction. And now what if I get that reaction? That could be me. Wouldn't that be awful or horrible if I did it too? I don't know that I want to take the risk of doing this. Now, as I read it, you probably have a greater risk of getting injured in a car accident than you do of getting that one reaction to the medication that you're taking. So all of us have to really make some decisions around what kind of risks we're willing to take, right? Are we willing to take a risk and do something? And are we not willing to take a risk to do something? Are we willing to take a risk to feel better and to get better? Or are we only going to say, only if I have 100% guarantee that something's going to work, am I going to actually do that thing? And the reality is, of course, that we don't ever have 100% guarantee that anything is going to work. And we have no guarantee that there will not be any negative side effects about things as well, too. There are people who go into surgery and don't come back, even though it might be a very routine, simple kind of surgery. And there's other people who do surgeries that are highly risky and everything, who make it through and do wonderful. just like with medications. There are some people who are going to take medications and are going to be amazingly better, and there are other people who may take them and have side effects that are very difficult, right? Uh, OCD wants to know what's going to happen before it happens. It wants that guarantee about how it's going to turn out and what the results will actually be before you actually do it. And of course, you're not going to be able to do that. You're going to have to try it out and see. So, the one thing that I would say, Emery, is about medications is that if you do attempt to take a medication and you find that the side effects are too difficult and something that you don't like, that's what you work on with your doctor. But because there's a chance of them happening, I don't know is necessarily a reason to not take the medications. And this is where we have to take some risks and things and see how things go. All right, Jess, let's see how you sound this time, if that works. We'll try this one more time. Otherwise, we'll have to try again on another night. So,
Okay, how about
yeah,
now?
that's good.
Okay.
All right. Let's see. Can you please talk about OCD in children? What does treatment look like? OCD in kids has very similar things to OCD with adults, and we do exposure and response prevention therapy. But one of the biggest things that you want to make sure that you're really working on when you're helping people, especially younger people with OCD, is that you're taking a look at how much family accommodation is going on and what role the family is playing in accommodating the OCD, and how much are people helping out with some of the rituals that are occurring, how much are people providing safety behaviors for people. I've seen families who've gone out and they're buying new bars of soap every day for their child. Their bathroom, has paint peeling off of the walls because the showers have been so long. There's been floods in the house from the bathtub and everything. And the family just gets everything fixed and does all that they can, because a doctor one time told them, just try to make them as comfortable as possible, which might actually not be the best advice in the world, right? Because OCD loves that advice. OCD is a big fan of any doctor that would say, try to be as comfortable as possible. But that is not actually the thing that is going to be helpful to you in the future, right? So you want to make sure that any therapist who's working with someone who has OCD, who is a kid, is also assessing what is the family structure in this experience and how much is the family contributing in all of this, and what can you do to help to decrease some of the influence that the family might have in this as well. All right. Kaylee or Coley says, any words of hope for a parent suffering from POCD? I'm constantly scared and it's ruining my motherhood. I worked with someone once, and I can talk about this case because we got permission to, and actually an article was published on this case in a journal one time. And someone came in to see us, and she had a 6-month-old, and she did not touch her child for the first 6 months of her child's life because she was afraid, what if I were to molest my child? Now, she did not want to molest her child. She had no interest in molesting her child. In fact, she did everything she could to try to protect her child. And that's why she felt, if I have even a hint of a thought about something that's awful and horrible, and I should not do anything that would even remotely be potentially possible of a way that I could harm my child. Now, this started even before the child was born, when she was given gifts at a shower. She didn't open any of them. She just had the boxes there, but she wouldn't open any of them. And the guests thought it odd. And what she did afterwards, after everybody left, is she put on gloves and a mask and an old sweatshirt, and she took all those gifts and she put them in her car, and she drove those gifts back to the stores that they were purchased from, and she exchanged them for identical gifts. And the reason she did that was because she feared that if the gifts had gone from the store into someone's home and that person had a cat, what if the cat had gotten some cat litter somehow on the box and had walked on it or something, and the box could contain bacteria on it that could be harmful to her unborn child. We know that pregnant women are not supposed to handle kitty litter, and therefore she wanted to be sure that all of the gifts that were coming into her home were not going to have this bacteria on it. So she literally exchanged all of them. And then upon having her baby, when they wanted to give her the baby to hold afterwards. She let her husband hold the child, but she did not, and she just looked at the baby, and she did not change diapers or anything. Eventually had her mother move in to the home with her and her husband, and they took care of the child. And finally she came into our intensive program so that we could start to teach her how to interact with her child. And that was anything from holding her child's hand all the way up to eventually changing her son's diaper by herself. And we built an entire hierarchy ladder of processes of behaviors to do between just holding his hand under the supervision of someone all the way up to her being alone in a room and changing her son's diaper. And the day she did that, finally, we had her alone in the room and we saw the door open and she walked out and she was actually holding her child. And that was the first time she had ever held her child, was when her child was 6 months old. So I say this, Goli, so that you know that there is hope out there, because we have worked this, we have seen this, we know that this can be helpful. And we know that OCD, again, believing it to be a helpful thing by telling you, hey, Coley, here's all the bad things that could potentially happen to make sure that you don't do any of these things, scares you so much that you lose the ability to enjoy the relationship with your child, and you only fear the ways that you might be harmful to your child. But Coley, I want you to know this. You've never seen a newspaper article that leads off with person with OCD actually goes and does the things they've been afraid of. And so this is the time for you, Coley, to start taking some risks and to do things that are uncomfortable and learn that you can handle those things. Jessica, any things like that for you, or something similar where you had to face some of those really difficult experiences?
I mean, I can't speak to POCD, but I've had harm OCD
Hmm.
directed toward both of my children. So it's sort of that same fear that you want to protect your children, you want to keep them safe, you don't want anything bad happening to them, and obviously you have intrusive thoughts that are opposite to that belief, and so it becomes a very scary, um, heart wrenching thing, especially when it involves your children. And the thing that got me over it was physically touching my children. I mean, I was listening to you tell that story about the mom going so. I mean, imagine how much fear the mom had to be feeling to not physically touch her child.
Right.
And because as mothers, we want to nurture our children and care for our children, and so imagine that. But so I just um, well, we have to do the opposite of what OCD says. I was watching your show a couple weeks ago, and you said if you want to stay on the OCD wheel of hell, keep doing what OCD wants you to do. I
Yep.
literally typed it up and printed it out and put it in my office. If you want off of the wheel, you do the opposite.
Mhm.
And so obviously the harm OCD is trying to make me stay away from my children because if I don't go in the same room with them, if I don't, whatever, then I'm not going to harm them, right? So the thing would be to go in the room with my child, to sit beside my child, to put my hand on my child's back, to rub my child's head.
Mhm.
So, you know, we have to do those exposures so that we can get better.
And they suck, don't they? I mean, they're mhm.
They suck, yes.
Mhm.
They're not fun. The
No.
afterwards is fun.
Yeah. Yeah. When you can live the life you want to live and not the life OCD wants you to live, it can be fun, right?
Correct.
Mhm. And for those of you who, are struggling out there and who want that, and maybe therapy's been difficult for you to be able to find or afford, no CD for the next 48 hours, and now add another 4.5 to that. So 52 and a half hours is doing a special. We are doing our No OCD campaign with
Mhm.
Howie Mandel to get people out there to realize what OCD is, that OCD is not a joke. And hearing that from a comedian is pretty powerful, I think. And so we're offering sessions. If you do a first session with us by the end of March, so again, by Friday at midnight in your time zone, if you set that session up and you complete it, that session will be $100, and we will give you that same $100 per session for the first 2 months of doing therapy here at NoCD as well too. So check us out at nocd.com or download our app on the Google Play or iOS and hit the therapist button there as well too. Lainey says your 16-year-old daughter did the Bergen method. She's 90% better. Not sure if it's just anxiety at this point or not. How can we tell the difference? Hard to say, Lainey, without knowing specifically what's going on. For those of you who don't know the Bergen method, it was a method in Europe that people have worked of doing some really, really intensive work in OCD, like nonstop for a week kind of thing. Very, very intensive experience. Lainey, what I would suggest is that if your daughter is still struggling with some things, you want to make sure she still has an outpatient therapist who's going to be working with her to kind of do all the nice finishing of whatever it is that needs to be done there. There's the people who come in and are great at doing the big projects, and then there's the finishers who kind of smooth all the edges out and make sure that things are going well. So, Lainey, hopefully you will be able to do that and get someone for your daughter who can help her with any of the rough edges that might be left at all. 3NA says, I would like to ask, how do you start ERP? How do you continue without freaking out? Jessica, I'm going to throw that over to you about that, because you had to do that at some point. You had to decide to start ERP, and you had to do it without freaking out eventually as well, too. So, how did it work for you?
Yeah, so I hear this often from people, like, I'm gonna freak out, or I'm having OCD and I'm freaking out. Okay, well, you're freaking out. Like, that's okay, right? You're still breathing, you're still alive, you're still here, and so it's okay if you freak out. So for me, choosing to do ERP was a no-brainer. I was in severe OCD, so I was stuck on my bed. Anytime I would step off of my bed, it was just like the weight of the world pushing me backwards because of all of the fear. And I thought I was going to drop dead like right there. So starting ERP, was a no-brainer. Um, that first exposure, did I freak out? Um, Not in the exposure, but after the exposure, I did. And so, it's okay if you freak out. When you do the exposure and then you reap the benefits, that is what's going to keep you to do more, keep you to allow you to move forward and to keep doing more exposures because of the benefit.
Yeah, I love the phrase, you can only be brave if first you are afraid.
Yeah.
Right? If you're not afraid of something and then you just kind of go do it, is it really bravery? No, I think bravery means, you're shaking in your boots, and yet you still work up against that and you go do something to challenge that, right? And I look at ERP that way, that you've got to be brave to do ERP. And therefore it means you're probably going to be pretty uncomfortable and scared and nervous about doing this thing, because it isn't easy. It isn't fun. It isn't enjoyable. It isn't something that people are thrilled about doing. But at the same time, I'd also contend this for everybody listening, that ERP is really not much different than anything you've ever done in your life. So if you know how to walk, you've done a version of ERP. You've exposed yourself to standing up and not having great balance, and you've fallen down, and at the first time that you fell after standing up, you could have looked around and been like, well, that sucked, I'm not doing that again. And you could have spent the rest of your life crawling. But no, you didn't do that. You, instead of just staying on the ground, which would be some kind of safety behavior, you did a sort of response prevention behavior. What did you do? You got up and you tried it again, and you did it again, and you did it again. And you kept doing it and doing and doing until what? You learned that you could handle it. And once you learned that you could handle it, well, then it wasn't so scary anymore, was it? And then you went from walking to running and jumping and all these other things. as you've done all those things and mastered some of that, it got easier. And then you learned how to ride a bicycle, and you started on a tricycle maybe, and then, or a big wheel, or if you're really cool, you got a green machine. And then you got to a bike with training wheels, and then the training wheels came off, and one of your parents probably held the bike for a while, and then they pushed you, and then you promptly fell and bashed your face on the cement if you were like me in the city. And you had a choice. Do you get back on the bike again, or do you not do it? And do you be like, no, I'm not doing that anymore. So all of those things are things to kind of consider, right? That if you're doing things in day-to-day life that can be seen as difficult things, you've done a version of ERP to get to those things, then I want you to keep that in mind as you continue to challenge your OCD, or even just get started in it and see what happens.
Doing your compulsions is difficult
Yes.
because you and it's and you're choosing. So I like that you used the word the choice a minute ago to get back on the bike,
Yeah.
because it's a choice. You have to make the choice. Do I want to
Yeah.
continue to do my compulsions, and my OCD symptoms probably worsen over time? Maybe they'll stay the same, maybe they'll worsen. They're most likely not going to get better. Or do I want to choose to make myself uncomfortable and do an exposure
Yeah.
where we have backed up proof, um, knowing that my life is most likely going to get better,
Yep.
and I'm not going to have to live in this torment and this suffering.
It's such a hard discussion at times when you say to people, you have a choice to do compulsions, and people will say to me right off, I can't not do
Yeah.
compulsions. It's not a choice. And my reply is always the same, which is, if you didn't have a choice to do compulsions, then there's nothing I can do for you for therapy, because you'll just have to do compulsions forever. But what have we seen time and time again in treatment? There are people who have stopped doing compulsions. So did they suddenly go from I can't stop doing it to I can? Or did they decide, I'm going to be brave this time, though I'm afraid, right? This is the time to be brave and not do what my OCD wants me to do, and recognize that my OCD has done pretty much nothing but lie to me my entire life and told me all of these things that in reality are just not true. They are just not real. And I don't have to believe anything that my OCD says at all. I just don't have to do it. Jay says, why doesn't sexual orientation for you feel real? You're a person who identifies as being straight and have always been dealing with it since a teen. You're married and love your wife. Do I have to leave her? It feels real. Difference between OCD and denial. Well, this is interesting because you say at the beginning, why doesn't it feel real? And then here, just 2-3 sentences later, you say, it feels real. So I think right there, we're showing some confusion in this whole experience, because how can it not feel real and feel real at the same time, right? Now, again, what I would say is this: are you having obsessions and then doing some kind of compulsion to assess this entire experience, right? Are you checking? Are you researching all these things? And do you get an immediate kind of relief from that when you find an answer, but then just, seconds to minutes later have to go through the entire process all over again? Then you're looking at obsessive compulsive disorder, right? And so, Jay, by the fact that you're even confused if it feels real or doesn't feel real, leads me down the line of make sure you're working with a therapist on this, and they can kind of help you to figure out exactly what's going on, and they can assess what kind of ERP might be helpful for you in this type of situation. Okay. Kiara says, what subtype of OCD is continuously asking yourself what's wrong and why don't you feel normal and being obsessed with any anxiety symptoms? I don't know if that has a subtype necessarily, other than OCD is the doubting disorder. And so if you're constantly doubting if you're feeling okay, and you're constantly doubting that things are normal, you're probably going to be looking for things that aren't okay and aren't normal all the time. And when you do that and identify that, you have some kind of reaction to it and will want to do a compulsion to try to neutralize that. And then that'll feel good for a moment or two. And then you'll have to do the whole thing all over again and again and again and again. And you're kind of in a loop. So, Kira, I would ask, maybe think about something along this line. What's wrong? Well, first of all, what is normal? Jessica, what do you know what normal is? I have no idea what normal is, but I don't know.
No, but I
Okay.
wonder if they're talking about checking.
It could be. I mean,
Because
there's
I had a theme where I would, do I feel okay? Am I all right? Is everything okay? Like looking out for danger? Um, and so I would like check to see how I felt. I would check to see how the world seemed. I would, so for me that was checking, or it was just right.
and was there ever a point where you felt like, yeah, everything's okay, or would that just last for a little bit and then you'd have to do it all over again?
Or it would make it worse.
It would make it
Well,
worse.
I know now that it would make it worse.
Hmm.
So when I stopped doing it, that's when I believed that everything's fine.
Hmm. So when you were checking to see if things were fine, nothing felt fine.
Correct.
But when you stopped checking to see if everything felt fine, you suddenly settled into a rhythm that seemed like things were okay.
Yes.
So you're saying, don't want to put words in your mouth, but you're basically telling all of us checking did not help you. It made things worse.
Yes.
Okay. And the opposite then being true, stopping checking made your life better instead of worse.
Yes.
So the moral of the story is that doing what your OCD wanted you to do made you feel worse, and doing the opposite of what your OCD wanted you to do actually led you to feel better.
It absolutely did. It was hard. It was not easy at all to just say, well, maybe I feel crazy, maybe I feel weird, maybe I feel abnormal, maybe things aren't okay, maybe I'm going to die in 3 minutes. It was hard to do that and sit through what came up. But after doing it, then it was very easy to say, oh, yeah, there's that thought that makes me think that I need to check how I am. I'm not going to do it. Moving along. That became very easy.
Looking back now, what would you say to that person in the throes of OCD today? Not the thing that you
Um,
think would have changed you, because I believe thoroughly that people in the throes of OCD like that are not going to hear a word or phrase and be like, "Oh, okay, well, never mind." But what, or maybe it's a different statement. Do you think you could even recognize that person anymore, or what kind of connection do you even feel to that part of you, looking at you back then to where you are today?
I have to have a lot of self-compassion. Um, trying to not cry. When I think about that person, um, it's very upsetting at what I went through,
Mhm.
and at times what I allowed myself to go through. I think I put up a pretty hard once I realized that it's OCD, that I can do exposure. I think I put up a pretty hard fight, and I had to fight really hard for 2 years. And now I'm not clinically significant, so I don't even measure for OCD right now. But when I think back to that time, God, that was so freaking hard, and I don't know how I lived through it. And so I do have to offer myself a lot of compassion. I don't know what I would say to myself. Like, just hold on, keep holding on. You're gonna make it.
Yeah. Sometimes I've heard people say the only thing that I can think to say to that person is someday you're going to meet someone who's going to ask you to do something that you now think is impossible, and I hope you'll trust them as they walk you through that experience. Because you really do have to put your whole life in the hands of someone else to guide you out of OCD, because OCD is only going to guide you into more OCD. I've not seen OCD be like, all right, we've been around long enough. We'll slowly get her out of it now. That isn't the way that it works, right?
I'm tired. I'll see you later.
Yeah,
Can I
yeah,
go take a nap?
yeah. I'm out of here. I'm good. That's not what happens, right?
This is more, 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 more.
Yeah, exactly. Corbin says that you have POCD and fear that if you do ERP, then your therapist will accept you until I say something like a compulsion or intrusive thought that makes even them believe you're a pedophile. Well, kind of again on this notion, I have treated thousands of people with POCD, and that, Corbin, would mean that I believe that all of them are pedophiles. If I'm taking what you're saying, I do not believe that, but according to you, I would have to believe that, because one day all of them would have said something that would have forced me into some kind of belief that would have led me to truly believe that they were this thing. So I don't find that to be the case. Now, Corbin, of course, I can't give you a 100% guaranteed answer either, which is what I know that you would like to hear from me. That, Corbin, there would be nothing that anybody would ever hear from you that would lead them to believe that. I can't give you that. I can't promise you that. I can't guarantee that. I can't say that, because I just don't know. All I can tell you is my own experience is that I've not seen it happen, but it doesn't mean that it can't. Now this really angers people with OCD sometimes when I speak this kind of truth, when they would just like for me to say, can't you just tell me that everything's going to be fine or okay? And I always say to them, well, I could, but then I'd just be giving into your OCD like everybody else. And then why do you need to pay me for my time when other people could do that for free? Right. So you did not hire me to tell you all the things that your OCD wants you to hear. You hired me because I can offer you things that your OCD does not want to hear at all. And in doing so, I can be helpful to you, actually, if that's the case. Jess, I'm sure it was difficult having therapists ask you to do things that felt very against everything that you wanted to do.
It did. It was the ones I found the most difficult were somatic exposures, because in the midst of my severe OCD, um, I acquired PTSD, a
Mhm.
very acute stress disorder and immediate PTSD from an event that I almost died from. And so OCD latched onto that at a certain point, and so then I had to do exposure work for OCD that also involved my PTSD, and so that was an extremely difficult time. And I would almost be like, okay, you're absolutely crazy if you think I'm doing that.
Yeah,
But obviously, I eventually did that. So
yeah.
yeah.
It is interesting how OCD does love to jump in and uh, be the savior and say, "Oh, you've had this other horrible thing happen. I can be very helpful to you in that situation. So, if you want to make sure you don't have another trauma, let me jump into the fray a little bit, and I'll have you have these obsessions about things that have been traumatic in your life and do these compulsions. These compulsions are magic, right? They have magical spells attached to them. And what do compulsions do? They prevent awful, horrible things from happening. It's if they're lined with fairy dust and unicorn poop or something of that nature. And the reality is that all they do is feed OCD and make it larger and larger over time. So people with OCD have been tricked. And they've been tricked into believing that doing a compulsion is actually a good thing to do, when the reality is it's the thing that makes OCD worse over time because it feeds the OCD. So we want to break people of that cycle. We want people to not be tricked by the OCD and learn that they can handle things.
Yeah.
One more reminder as we're getting into our last quarter of our hour here. One of the things we're doing here at NoCD this month is if you have a session with us by Friday at midnight in your time zone, we will be able to discount that session to $100. And for the next 2 months, all of your sessions will also be at the $100 level. So for those of you who don't have insurance and are cash pay, we know that therapy can be expensive. So in honor of our work with Howie Mandel this month and our No OCD campaign, that's KNOW-OCD, check out that hashtag. We're trying to do education out there around OCD and the idea that OCD is not a joke. And so please, check us out, give us a call, reach out to us at our website, nocd.com. There's a quick little button on there you can press and you can get set up with our team. And you can also download the app and click that little therapist icon on the app as well too, and that'll get you in and you can sign up and we'll call you and we'll do an intake with you and we'll get you set up with one of our NoCD therapists in the US or Canada or Australia or the United Kingdom as well too. So check us out. Let's see. Olivia says, you have ROCD and you have trouble with obsessing over your boyfriend's appearance. How do you stay present with him when you're struggling with strong feelings internally? First of all, to recognize that it probably doesn't matter who you dated. There would be something that you would struggle about their appearance with, right? So OCD will say to you always, the grass is greener somewhere else. There's always somewhere else you can go. There's someone else you can meet. There's someone else that you could be with. And why don't you go find them and be with them? When the reality of it is, of course, is that, OCD says that, but there's not a lot of truth to that whole experience, right? Because the moment that you go and do what OCD wants, two things will happen. Who the new person is that you date will then be subject to OCD. And then OCD will probably throw some guilt at you as well, too, saying, well, this person doesn't do all the other things the previous one did. I mean, yeah, maybe they had a little bit weird hair that grew out of the middle of their nose, but, you could have plucked that maybe. And they were such a better personality than this one you're with now. And how could you have ruined that and everything? But because OCD will never take the blame for the ruin. OCD will say you ruined it, not that it ruined it. But the reality, of course, is that OCD ruins everything and doesn't make anything better whatsoever. Jessica, were there things in your life that, you just felt like OCD kind of, put a turd in the punch bowl at the party for or anything like that? Mm-hmm.
Yeah, so actually, I had mentioned maybe kind of taking a few minutes to tell kind of like
Yeah.
my initial
Good time as
story.
any. Yeah. Mm-hmm.
Yeah, and I saw the next question from Jay asking about logic, and so that reminded me. So I also wanted to tell this story. I think we had the Corbin that had asked about POCD. I think, there's a lot of shame sometimes, a lot of embarrassment, shame that can come along with OCD. And so maybe we don't want to tell someone that we need help. Maybe we do recognize that something is off, and and but we're feeling shame, we're feeling afraid, we're feeling like we're going to get judged or people are going to think we're crazy or whatever, and so we don't speak up. And so I just want to encourage anybody out there tonight that maybe hasn't reached out for help because of those reasons, to pick up the phone and reach out, because especially to NoCD, because NoCD is there to, they understand OCD. They're not there to judge you. I've gone through their whole process. I've participated in their therapy. I've participated in their support groups. I absolutely love the support groups. I learned so much. It actually, after finishing therapy, learning so much from other people with OCD really just jolted my progress. But to tell you my story and what happened to me, so I did originally have OCD that started way back in my 20s. I lived with it for a good while. It kind of came and went on its own over time. I did a little bit of exposure therapy in my 30s. I really didn't know a lot about OCD or understand ERP really, but that little bit of exposure work I did in my 30s caused OCD to go away for like 10 years. So um, in November of 2019 is when everything got super bad for me. But the year prior to that is when my OCD flared up and I had a complete lack of insight that OCD was prevalent in my life. So I was working a very stressful, strenuous job. Um, and my son said something to me. He said, "Mom, there's something white in your mouth." And I said, I freaked out. Okay. Well, I have a disorder called where I have extra growth of bones in my mouth, and it's called tori. And so in the lower part of my mouth, I have extra bones. Well, I've always been um, I don't know, like self-aware of it. I don't like it. I don't like for people to see whatever.
Yeah.
And so when he said that, my brain immediately went to cancer. You have mouth cancer. You are going to die. And so my OCD from 10 years ago latches on to this comment that my son made. And so for a solid year from 2018, when he said that, all the way to November of 2019, I obsessed 24 hours a day about my mouth. Anytime I was awake, I was obsessing about my mouth, thinking that I had mouth cancer. I had waited too long. I was going to die. Even if I went and got help, I was going to die. There was no hope for me. It was just obsess, 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 obsess. And then in compulsion, 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 compulsion. And it took up so much of my life that I was starting to have severe panic attacks. And so finally, one day I was at work. I could not take it any longer. I picked up the phone. I called my daughter and I told my daughter um, what had been going on in my mind. So my daughter's like, okay, let's make a an appointment with the dentist. You can go have it checked out. We go have it checked out. Dentist is like, oh no, it's just your regular tori. Nothing's wrong there. Everything's chill. Well, okay. So I'm calm and chill and happy and excited for several days, right? Well, OCD is there because it has been living there for over a year now. I was so convinced that I was going to die that in June of 2019, I had planned a vacation for my children. I took them all to Niagara Falls. I did a 2,000-mile trip. Went to Niagara Falls. We went to the beach in Maryland. That's how convinced OCD made me. I was like that I was going to die, and so I had to have a last
This was
trip
the last
for
trip.
the
Yeah.
both of them.
Okay. Yeah.
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 And so anyways, after I had gone to the dentist, he debunked OCD. Guess what happened? OCD took over and harm OCD with my son. And so now it's full blown harm OCD with my son. I could not stand to be in the room with him. I could not be alone with him. I was so out of control. And even though I had had OCD in the past, I still completely lacked insight
Yeah.
that I was having OCD and that I needed to do ERP.
There's your
And
insight. Yeah.
yeah, and so I chose to take myself to a mental hospital. I got serotonin syndrome. I was denied medical treatment, and that's why I got acute PTSD. Um, and so I finally I fought my way out of the mental hospital, and I lived for another year before I heard about no CD. And so I was sitting on the bed, December 2020. I saw a ad on, I guess I was on Facebook or something. I saw a no CD ad, and I contacted no CD and I got into treatment. And that's when I finally started to get better. So, no matter what your thoughts are, no matter what those intrusive thoughts are, no matter how much shame you're feeling, guilt you're feeling, tell someone, reach out. Do not live in that pain and suffering, because there is help and there is hope. And so, don't stay in that suffering for a day longer.
Yeah, I agree. OCD would like you to just suffer and be uncomfortable. It's not a big fan of you going to get help and therapy and challenging things and facing your fears. But just just remember that OCD doesn't care about you or your friends or your family or anything of that nature. OCD cares about one thing, and that's OCD, because all OCD wants to do is stick around. OCD does not want to go away. OCD does not want to be bothered with or bugged or anything of that nature. OCD just wants you to leave it alone. And so, you know, it's one of those disorders that's amazingly difficult to treat, and why you really want to make sure that you find specialty care for it, because I think, Jessica, your story even points out, when you're not getting the right treatment, things can even seem to get worse instead of better, right? So
Yeah, because that first year I was only getting talk therapy and I was only getting therapy for the PTSD, so I was not getting better, and they couldn't
yeah,
understand why I was not getting better.
right. So if treatment's with no CD, awesome. If it's with someone else, great, as long as it's the right kind of therapy. And we want all of you to make sure that you're getting evidence-based treatment. That is so, so very important. And why, again, we're doing our No OCD campaign as well, too, to make sure that people understand that OCD is not a joke. For those of you with OCD, you've likely been offended when you've heard people say things along the lines of, "Oh my gosh, I'm so OCD." Or when you've said finally that you have OCD, people's first response is, "Oh, I have a little of that too." And how annoying that is, and how, I think, almost kind of disrespectful that is to people who are really struggling with something. Imagine if somebody came up to you and said, "I just had this weird thought," and you said to them, "Oh, it's probably just a little schizophrenia or psychosis or something of that nature," right? And they would be like, "What are you talking about? Why did you say that?" Right? But when we say, it's just a little OCD," it's like, "Oh yeah, okay, yeah, I'm sure I have a little OCD or something of that nature." So it's almost like it's okay to have OCD. And of course, those of you listening tonight who have OCD know that nothing could be further from the truth. Nobody wants OCD. Other than OCD, nobody really wants OCD. OCD is kind of like your in-laws and fish. It goes bad very quickly and needs to get out of the house. And so the best thing that you can do is to work on challenging that. And we hope that you will reach out and find a therapist. Again, if that's with us, and you reach out to care@nocd.com, or you go online and you go to nocd.com and you download the app, or whatever you might do, and you take advantage of our special that we've got going this month. Again, if you have your first session within March, it'll be $100 if you're paying cash, and we'll keep that $100 rate going for 2 months for you for all of your sessions as well, too. And if it's not with us, that you could check out the International OCD Foundation, and you can find a therapist through them in your area if you want. But whatever it might be, you do what you need to do in order to make sure that you're getting better, and you're, again, not living the life that OCD wants you to live, but you're living the life that you want to live. That's what's most important, I think, all the way around.
I agree.
Jessica, thanks once again for being with us tonight. It was good to have you back, and thanks for sharing your story as well, too. I know it will be inspiring to some people who are going to hopefully take that first step and get out there and start to work on their OCD and challenge things. And we hope all of you make it the best week possible, and do something this week to challenge that OCD, to not give in to those compulsions, and to be brave. We know that it's anxiety provoking to challenge things and to take that first step, but in order to be brave, you got to be anxious first. So it's time to be brave and take those steps. And if that's doing ERP with yourself, if it's reaching out to us or someone else, go do it. Change the life. Live the life you want to live. We'll see you again next week, everyone. Thanks for joining us.